President Cyril Ramaphosa signed the National Health Insurance Act into law on Wednesday, 16 May 2024. Now, on to the big questions. What was President Cyril Ramaphosa thinking about power? The ANC is facing a tough election battle, the toughest in 30 years. It will do all it can to win a majority in the 29 May elections, and the final push over the next fortnight is crucial for the party. You have to understand the passage of the NHI Act in this context. How will the NHI work? Will it improve the quality of healthcare services? Daily Maverick's Takudzwa Pongeni reported from the signing ceremony where President Cyril Ramaphosa said government wants to build a Rolls-Royce healthcare system for all. He said that some South Africans had been fearful of universal suffrage in 1994 and again when the right to strike was enshrined in law, but these fears had proved baseless, as fears about the NHI would too. Will ANC politicians be prevented from going abroad for treatment? Unlike the practice in much of our continent, there isn't a widespread practice of leaders going abroad for treatment because the health systems they create are so bad. South Africa has excellent doctors and great hospitals across the public and private spheres. Political leaders get more treatment at the military hospital in Pretoria, and health ministers have made a point of using the public system. Like all civil servants, they belong to GEMS, the Government Employees Medical Scheme, and use the private system. Once the NHI is fully implemented, GEMS will no longer exist in its present form, as will all medical aids. How will the NHI be funded? The NHI philosophy is to pool all the spending in the private and public health systems, which together come to 15% of the GDP. It's still not enough, and calculations from Discovery show that the new system will require hefty increases in VAT, personal income tax, or corporate income tax. Can I continue to go to my private sector doctor? Yes. The system will take decades to kick in, and once it does, healthcare professionals will register with the NHI and presumably be able to still see their patients. The difference is that you won't pay your doctor, but the NHI fund will. There are many questions of how this system will work, and it will be decades before there is clarity. How will the NHI affect medical aid schemes and private health insurance options? Once fully implemented, it will mean that medical aids will only be able to offer top-ups to what is offered in the NHI system. The National Treasury says full implementation will take 3 decades. Even when the NHI is fully implemented, medical schemes will still be able to provide cover for benefits not covered by the NHI, wrote Discovery CEO Adrian Gore in a note to members this week. In the following months, we will bring you good information and solid facts, taking counsel from the finest thinkers across our country. Stay informed, follow us on social media, and subscribe to Daily Maverick's YouTube channel for more news and in-depth analysis.